Hello, welcome and kumusta. My name is Hao and I am your occupational therapist and welcome to my podcast entitled OT Conversations. This is a podcast about occupational therapy and any other topics relating to the field, be it medical foundations or philosophical foundations, some of my personal and professional opinions and point of view. I am hoping that through this podcast, I'll be able to help out occupational therapy students and clinicians to navigate their way through their clinical practice involving occupational therapy. I'd like to talk to you about some of the skills that you need to learn as an occupational therapist. The first one being the professional foundation skills. The first skill that you need to know is the professional foundation skills, particularly the philosophical foundation. Now let's go to the technical foundation skills. And these would be the know-hows, technical skills, the practical skills that an occupational therapist need to develop, or a student, or an occupational therapy student needed to develop. The first foundation skill is the skill of conversation and interview. As an occupational therapy student, you need to be able to perform and you need to do interview, or you need to have interview skills and conversation skills. This is because it is very important to establish your rapport with your patient, and you need your interview skills so that you can establish and you can identify what their problems are. It's through this skill that you'd be able to set essential objectives that will enable people or your patients to be discharged from the service. So how are you going to discharge a patient? How are you going to manage your treatment plan? And how are you going to set the functional targets or the occupational targets? This is very essential to have these conversation skills. Another reason is you need to develop your foundation skills because you should be able to communicate, you should be able to support, and you should be able to motivate the patients during your treatment. As an occupational therapist, your treatment is not just something that you will give to a patient, like a pill or an exercise or an injection. As an occupational therapist, when you're doing your retraining, these are practical interventions, and you need to be able to support and motivate your patients. And the final reason being that you need to be able to terminate the session and should have a therapeutic closure of the service. So having your communication skills, that's really important, because when everything is done and everything is complete, then you need to relay that to the patient. And how are you going to best relay that? It's through your communication skills, through talking, through motivational interviewing. So that's one of the foundation and technical foundation skill that I feel you need to have, your interview and conversation skills. The second technical foundation skill that students and aspiring OT clinicians need to develop are the skills, or is the skill of physical handling skill. OTs should be able to touch, you should be able to hold or handle or move a person's body. You should be able to handle segments like the head and neck. How are you going to move the person's head and neck for an adult population, for pediatric population? So you need to be able to support the head and neck. What about their shoulder? If you need to move the shoulder and you need to have some physical interventions on the shoulder, you need to be able to move the shoulder. You need to know where to handle and to support the arm, the forearm. What about hands and fingers? You need to be able to hold them if you need to do some passive movement and passive stretches and you want to do some hand therapy. You need to know how to handle hands and fingers. What about the trunk? Where are the key points of control? So I'd like you to think about these things. The pelvis, the hip, knee, ankle. Generally, all segments of the human body. Develop that skill of learning how to handle a patient, how to handle body segments, so that when you have to do some adjunctive therapies and restorative interventions that are focused on particular body parts, you'd be confident and you'd be safe to handle them. That way, you will not need to rely on other professionals and you can avoid having joint sessions, right? Now, you should be able to manage or do physical handling skills. You should be able to handle the body as it moves. So, while the body is moving, the first part is handling the body in a static position. So, that's fine. Body is not moving. But when you're doing your ADL retraining and you're doing your physical rehabilitation, the body will be moving and you need to be able to handle the body as it moves, say from lying to static sitting, the dynamic sitting, from the movement of sit to stand, rolling, kneeling, going on prone, standing, walking. So you should be able to handle the body segments as it moves. So the first one is just touching and holding the body segments in a static position. Good, that's fine. It's a controlled facility, it's okay. But when you're doing ADL retraining, the body segments are then moving. You need to be able to handle that. And you should be able to handle and support the body as it performs functional tasks. So, particularly with dressing, that's very important, with showering. When you do some approaches, tactile kinesthetic approaches, the Affolter's approach, then you need to do that. And you should be able to handle external devices as and when they are attached to the person's body. Like, for example, if they have catheters or monitors or orthotic devices and splints and drains, all of these things, you need to be able to do that. Now, you have to find out whether you can move these attachments on your own while you're moving the body, because sometimes it's not safe to do so, and you cannot hold and touch and support the body while the attachments are there. You can't do that, so you may need some kind of physical assistance from another person. So the third technical and practical skills that you should develop is the skill of problem and activity analysis. So you need to have that skill of analyzing the problem, and you need to develop that skill of activity analysis. So it is almost easy to analyze when something is wrong. So what I'm saying is it's almost easy to analyze when something is wrong with a person medically. I mean, there are some parameters like temperature. So when something's wrong with the body, there's almost easy to do that because of the parameters like temperature. Now, on a deeper level, there are chemical and biochemical markers when the person is unwell. Like people would measure their pH level, their infection markers, their oxygen saturation, lactates in the blood, white blood cells, blood count, red blood count. And these are among few of the chemical or biomarkers that you can measure, and you can analyze that something is wrong with the body because there is something not right with these biomarkers. But the body is like a chemical and biological petri dish, and it can easily be analyzed as long as you have the right tools and you have the right testing facility. Now, for occupational therapy, however, when a person is unable to perform the task, the therapist needs to have the skill of analyzing why. Why is it difficult? Why is the person unable to do the task that they needed to do? Is there a problem? Is the problem physical in nature? Is the problem because of cognition? Is it emotional in origin? Is there a contextual influence? Is there a context that influences the performance? And if these contexts are the ones that are influencing it, can these these causes be changed? Do we need to restore the body? Do we need to restore the impaired body function? Do we need to alter and work our way around the contextual limitation? Do we need to modify the task? Do we need to support? Do we enact on things to prevent problems from developing or getting worse? So, the answers to these things can only be established if you know what is the cause of the problem. So, to be able to analyze, a therapist should have a well rounded grasp of the OT's philosophical foundations, the medical foundations, and physiological foundations, and some of the technical skills as well. So, the technical skill that you need to develop as a budding clinician is the skill of measuring skills, technical ability to measure. So OTs should be comfortable in using a tape measure because a good proportion of your job will involve measuring. Occupational therapists will be faced measuring the body for, say, wheelchair sizing, for sizing slings, when you're setting up the furniture heights, when you're establishing where grab rails needed to be installed. Occupational therapists will be measuring the home environment as well for home adaptations, for minor and major adaptations. And if you have to design the environment, every design that you do will take its roots from simple and plain measurement. So you can say, you might be curious about how long a person's stride length is. How long is their hallway? What is the length that the person needed to walk? What's the distance that the person needed to walk? How long is it before the person starts to get tired? Or how deep or how high the steps are at home, the front steps, the stairs. What's the bath width? Will the shower accommodate a shower chair? Is there enough space around the toilet to accommodate a freestanding toilet frame? So I would advise any starting clinician to start learning how to measure and learning how to use a tape measure, because this is one very essential tool and it's a very essential device that occupational therapists in physical dysfunction cannot live without. In fact, if you're actually working in a hospital, you can ask an OT for a tape measure, and there is a very high chance that they will have a tape measure in their pocket. So that is the fourth technical skills that you needed to learn and you needed to develop. The fifth one, which I think may be the last technical skill, would be the writing skill. So writing is a very, very basic skill that occupational therapists need to have. And this is because your sessions, your assessment, your goal planning, and all of these will be documented in form of words. The reports that you will be completing, the referral that you'll do to other services, conflicts at work relating to patient care, patient's progress, and all of patient care are documented in a written form. So an OT should have the skill of prescribing the session and should be able to write it succinctly and direct to the point. So OTs should have that technical skills or technological skills and should be able to use digital platforms when documenting. So really, it is really essential to develop these skills. So really, to summarize, what are the technical skills that you needed to develop? The first skill being the ability to do the interview, the technical skills of interview and conversation skills. Second skill would be the physical handling skills. The third skill being that of problem and activity analysis. The fourth one being measuring skills. And the last one being writing skills. So I think if you have these 5 simple skills and essential skills, you're already a third there. Or that's the main physical work that you needed to do, really. This is the physical demand of your role as an occupational therapist. Well, there you go, guys. 5 skills that you needed to develop so that you'll be able to perform your roles as an occupational therapist. I hope you enjoyed this session. Until next time. If you enjoyed this podcast, talk to your friends and colleagues about it. Like it, subscribe, share, and do what you can to appease whatever algorithm that is at play. I am but your humble clinician, albeit with years of experience. I have very little understanding of this digital world. So if you have any questions or if you have topics that you want me to talk about, drop me an email. It's riot.conversations@gmail.com. Just remember, guys, anything you do matters and has an outcome. Until next time, bye.